I'm a medical surgical telemetry nurse, and I was just diagnosed with triple-negative breast cancer. I haven't started treatment yet, but before any of that begins, there's a different kind of hard I wasn't expecting. Figuring out how to actually say the words out loud. To my kids. To the people I lean on most. To my job. This one's about those conversations. Not scripts to memorize, just some real guidance on getting through them.
Kids can sense when something's wrong even before you say anything, and silence tends to scare them more than the truth does. They may feel confused, guilty, like something they did caused this, or just angry that routines are changing. A few things every child at any age needs to hear clearly. Nothing they did or said caused this. Having cancer doesn't mean I'll die from it, and many people live with it a long time. There are small things they can do that help, and no matter what happens, they'll be taken care of. With teens, it helps to invite their questions and opinions rather than deciding everything for them, and to remind them it's okay to lean on friends and other trusted adults too, not just you.
For the person or people you're closest to, family, a close friend, whoever that is for you, timing matters. Pick a moment without distractions instead of squeezing it in on the way out the door. Be honest about how you're actually feeling, even if it's messy. Hiding fear or anger just keeps people from being able to support you. And it's normal for the people around you to feel differently than you do on any given day. One of you hopeful, another scared. That's not a sign anything's wrong between you. It's just what this stirs up. If you're divorced or separated and co-parenting, this is its own short conversation. Tell your co-parent directly and early so you're both working from the same information instead of your child hearing two different versions. Kids do best with consistent messaging between both households, so it's worth agreeing ahead of time on the basics of what you'll each say. You don't need to be on great terms for this. You just both need to be on the same page for your kids' sake.
Work brings its own set of decisions. Legally, you don't have to disclose a diagnosis at all until you need an accommodation. At that point, there are no magic words required. You just tell your employer you need a change because of a medical condition, and they can ask what kind, not for your full medical file. The Americans with Disabilities Act covers people with cancer and requires reasonable accommodations unless they'd be an undue hardship. Things like a flexible or fixed schedule around appointments, working from home, rest breaks, or leave without a fixed return date. Your employer also has to keep your diagnosis confidential from coworkers. They can't explain your absence even if people are asking questions. And if your employer has 50 or more employees nearby and you've worked there at least a year, the FMLA can give you up to 12 weeks of job-protected leave for treatment. You also get to decide how much coworkers know. A simple, "I'm dealing with a health issue" is enough if that's all you want to share. And it's fine to say, "Thanks for asking, but I'd rather not talk about it right now."
I've had all of these conversations now, with my kids, with the people I lean on most, and at work. None of them were easy, but knowing the shape of it ahead of time and knowing my rights at work made each one feel a little less like free fall. If you're facing the practical side of all this too, bills, paperwork, disability forms, that's exactly what the next video in this series is going to cover.